God, and I was so hungry and super hungry after class. So, oh my God, we have actually to study for the test, for the quiz. Have
I
you been
know.
studying?
So I didn't bring lunch today because I had a late breakfast.
Oh,
So I can use
really?
my time
Oh,
to
that's what you
study.
know eating?
Yeah.
Oh my God, I was so hungry
I
after that
know.
class actually. Got some salad actually. It's really good. It has a lot of stuff like lettuce and tomato and a lot of like, good things, avocado as well. But
That's
the
nice.
bad
And
part
it's
is
healthy.
it is healthy. It's really healthy, but I wish I had like one like kind of dressing to actually make it more tasty.
I can go grab one. I think I have
Do
a
you have one?
dressing. Yeah, I can bring it for
Oh,
you. Yeah.
really? Oh, that would be
Yeah,
awesome.
sure.
Thank
Let
you,
me check.
thank you.
I think I have one in here.
Okay.
There you go.
Oh my God, this looks so good
Just
actually.
taste it if you like it.
Yes, actually I'm gonna just put it there because
Okay.
it looks like I wanna buy actually. Let me just put like a lot. Oh my God, this looks so good to eat actually.
Hopefully you like it.
Oh my God, let me just try it.
Okay, do you want me to go over the chapter so as I read you can just.
Yes,
Yeah, we
yes,
can do
yes.
that
Let's
together
do
if you
that
want. Yes,
first.
okay.
Yes.
Okay, so I think if we go study with the book, it
Mm-hmm.
will help us better than the
Yes, I was
slides.
thinking that because last time I was like reading from the PowerPoints, but there were a lot of things that they were in detail with the quiz. So can you actually help me to actually process
Sure,
everything?
we
How
can do that.
you can show me how you study
Are you
actually?
sure you don't want to eat?
Well, let's do this first, and I'm gonna be like starting eating in a minute
Yeah, okay.
actually.
So I think most of the slides cover most details in the book. So the way
Yes.
I study, I go over the chapter first,
Mhm.
read it, and then I review with the slides. Yeah,
Oh,
that's how
okay.
I
I
do.
was doing it backwards
Yeah.
actually. And then I have a lot of questions about it because I
Uh-huh.
was just basically basing my study with the PowerPoints.
Yeah.
Okay, like let me just try. I'm
Yeah.
super hungry. I'm
Yeah.
so
Okay.
sorry.
No, it's
Please, can
okay.
you excuse
No,
me?
you can eat now.
Okay.
And then
Hmm.
you need energy, to
Yeah,
concentrate.
I felt kind of weird though.
Maybe you don't like it, the taste.
No, it tastes good, but
Are you okay?
mm,
I think you're. Oh my God, you okay? I see red spots on your skin.
no, but
Are
like
you allergic to something?
it's hard for me to swallow actually.
Are you allergic to anything?
Yes, I am allergic.
So what are you allergic to?
I'm
Let me
allergic to
just check the
peanuts.
dress. Let me just check the dressing
Does
if
that
it has
have
peanuts in
peanuts
it.
in it?
Let me check. Let me check. Don't panic.
You just give me peanuts?
Yes, it has peanuts in it. Oh my God, I'm sorry. I didn't know. Okay, let me. Don't worry. I'm gonna lay you down. Okay. Do you have something in your bag?
There.
Let me just
Are you
ask
guys
for help.
okay? What's going on?
Could
Is
you
she
please?
okay?
She's. I think she has pen in
Make
her.
sure she lays down.
Could you check her bag, please? I think she has an pen in there. Put your head back. Put
Is
your
it
head
this?
back.
Is this your EpiPen?
Right there.
I'm
Oh
gonna
my
check
gosh,
your
where do I
vitals
put it? Do I
now.
put it? Let's administer her epi. Let me check her vitals.
Yeah, check her pulse.
Is it going
It's
down?
low. Yeah, it's going down. Are you okay?
Make sure you relax.
I started feeling a little better.
Okay.
Good. Just take your time. Make sure you're breathing.
Relax. So Gabby had a mild allergic reaction. So I'm just gonna go over the steps for the. So the first step is to recognize the condition that she had, like redness, and then she had itching, edema, and then after that we have to evaluate the vital signs, which I did for her, the pulse, and then the respiration, which is gonna be low because she has less oxygen. And then we have to position her supinely, so she has to lay down. And then after that, we activate the CPR. If you're certified, CPR certified, then we have to activate the CPR. And then after that, we have to ask her to go with the protocols of the allergy for taking medications, and we have to follow up with her.
If Gabby were having a moderate allergic reaction, you still recognize the symptoms first. The difference would be she'd have systemic redness, abdominal pain, cramping, diarrhea, bronchospasm, and mild dyspnea, so difficulty breathing. You also evaluate still the vital signs. You pay a lot of attention to her respiration because that's important, and then still position her supinely. You activate the CAPS and the CPR. Obviously, we need somebody that's CPR certified. We're checking circulation, airway, and breathing, so pulse and blood pressures are important here. The big difference here is to implement the appropriate emergency protocol for a moderate allergic reaction. You would inject Benadryl 50 milligrams intramuscularly. Obviously, we need somebody appropriate to do so, so usually the doctor that's around. Administer an oral histamine blocker if it has not already been administered. Administer oxygen as needed. Monitor vitals. Observe the patient for at least 1 hour to determine if symptoms are worsening or not. We would refer this patient to the appropriate healthcare professional if the condition does not improve. In addition, we also need a referral for allergy testing.
Thank you.
Okay, so when you're having a severe reaction, allergic reaction, you actually have to recognize the signs and the symptoms. So you have to see if it's severe, the patient has a hypotension or dyspnea or laryngeal edema. So you have to recognize, you have to see your patient, like all the signs, that look at her face, the skin of their color, how they are breathing and everything. So, and then you evaluate the signs and levels of consciousness. So if the patient actually faint, you go ahead but you're gonna react in a different way. So it's gonna be severe, you know. So, and then you have to position the patient supinely with the legs elevated. In this case, you saw me that was like in a flat position supinely, but actually with this one, you have to elevate the legs. And then after that, you have to activate the CPR because you're seeing the patient that is not active, is not awake. So you're gonna go ahead and check the circulation airway. You have to notice, as I mentioned before, if the patient is breathing, and then you actually have to do the CPR. So when the implementation, you have to go ahead and do an appropriate emergency protocol for severe allergic reaction. So you use the epinephrine. So when you notice that it's a severe allergic reaction, and then go ahead and administer hydrocortisone for 4 to 6 liters per minute. And then you go ahead and can administer Benadryl as well. So you have to monitor the symptoms closely until you gonna transport your patient to the emergency system, and then go ahead and prepare for the possibility of biphasic reaction. So you have to refer the patient to the emergency department for appropriate follow-up. And actually, this patient might be hospitalized because this is a severe allergic reaction. You have to be aware that you have to follow all these protocols to have a really good reaction with your patients, and appropriate protocols to go ahead and treat your patient.
Thank you.
There is a variety of allergic reactions that could happen, so that's why it's very important that you get an appropriate and an extensive medical history on your patient. You want to ask them about any allergic reaction that you could think about and anything that could happen in the dental chair so that you are better prepared for a medical emergency like this. Mild allergic reactions, moderate allergic reactions, and severe allergic reactions can happen from a variety of things. In our case, our patient Gabby had an allergic reaction to peanuts, which she already was aware, and we did have the EpiPen because she had it with her. If a patient has an allergic reaction to something that they weren't aware of, or even if they were aware of and they didn't have an EpiPen with them, usually your medical emergency kit has an EpiPen, so you would use that. But obviously, you would use the appropriate protocol for that allergic reaction. Most of your allergic reactions are going to have some type of redness of the skin. Usually for just a mild, it's going to be localized just to a specific area. For the moderate and severe allergic reactions, it's systemic, so it's all over the body. And then there's usually some swelling and itching involved depending on what kind of allergic reaction they have. If they're having cramping or some kind of a diarrhea, that would be moderate, and obviously a severe allergic reaction could lead into anaphylactic shock.